Like, there's no way they could watch what you do and be like, oh, this is clearly an MD versus a DO. I wonder, it sounds like you're very similar to that. Like, if somebody walked in and if they had pneumonia or something, would they even care what your license is other than, hey, you just took really good care of me. Like, I got what I needed.
Yeah, I mean, that's the goal, that they wouldn't
Yeah.
know, but unfortunately they do, because we also have, like, I can't order an X-ray. So if they needed that, they'd be kept on, right? I'd refer on. The other thing is where it comes with, like, our billing with insurance. So we have universal health care, but that only covers medical doctors. So if they were to go to their primary care doctor, they would, never see a bill. It would just be to the government. That would be that. Whereas I work in private healthcare, so we have to bill like extended health benefits, or it's cash pay. So a little bit different. Obviously, the goal is that they get great care regardless of where they go. And I'd love for them not to be able to tell a difference. But I also do kind of like that some of them most of my patients do feel like they actually get better care in private healthcare.
That is an interesting thing. So we, like with trust-driven care, we serve a lot of different clinics like mental health, chiro, PT, but we serve a few med spas and aesthetic clinics. And it's kind of along that same line. Like, there's no expectation in the States of any sort of medical or insurance coverage for med spas. And I will say, in general, they focus so much on patient experience because they know, that person, I got to work hard for them to pay me. And then if I want to get them to come back, I need to work extra hard. But what it results in is fantastic patient care, because it's the only thing. You're like, well, if you're going to pay out of pocket, I better do a little dog and pony show for you here,
Yeah, I better show my peacock feathers, right? No, You're so right. I think it does elevate the level of care that, not that I would treat people differently, but it is different when you don't have to work to build a practice as a family physician here. It's just, I could open up an office down the street and I'd be packed, right? But I don't want that either. So I like being able to.
I don't want to stereotype, but a lot of times when there is an insurance payment and everyone knows, oh, it's automatic. And I saw this with even my primary care here locally, is they get lazy. They just like, I know I'm going to be full. I know I'm going to have a booked out day. I know anytime I have a gap in my schedule, I can just send out a message and it'll fill right up. And when you go in, the bar is set incredibly low. And it bugs me because when we get lazy like that in medicine, also, oh, by the way, we misdiagnose people more often. We don't accurately diagnose people. People are hesitant to tell us how they really feel or what's really going on. And I talk about it on this podcast all the time, but like for back pain, I got to ask like some tough questions about like, do you ever have incontinence, like urinary incontinence when you stand up? Because that tells me, hey, there's probably disc material migrated towards your canal or, in the foramen blocking the nerve root. And so if you are losing control of your bladder when you stand up and stuff, I need to get an MRI right now. Right.
Mm-hmm.
But if we're rushing people through, like, what's the chances of like that 45-year-old kind of, 45-year-old male who really doesn't dig going to the doctor be like, oh, by the way, do you pee your pants when you stand up? And they're like,
right.
Like the no is out of their mouth before they even think about the question, right? And that's misdiagnosis. That's a false negative,
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of trust-driven care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust-driven insights, real conversations, smarter care, stronger business.